Oral and Maxillofacial Pathology is a specialty within dentistry. It focuses upon conditions in the oral cavity and the maxillofacial region, which includes the jaws and other parts of the upper ear and digestive tract. We're very interested in the effects, the development, and the underlying causes of a whole range of conditions, and we also provide diagnostic expertise in these conditions for our patients.
I became interested in oral and maxillofacial pathology by accident, really. I was doing my PhD, and during my period of research, I found that a lot of the skills that I learned in terms of the scientific method overlapped significantly with what a pathologist does on a day-to-day basis. Attention to detail, a meticulous approach to work, and the constant investigative aspect of the work and trying to answer questions really appealed to me. And it continues to appeal to me today. I find the job quite fascinating, and I come in looking forward to trying to solve the puzzle or the mystery to arrive at a diagnosis, and I often find myself asking questions to this day. So that's how I became interested in pathology.
Welcome to the pathology laboratory. This is where specimens from the clinic are transformed into glass slides that can be analysed by the pathologist. Each specimen is described and measured here in Qatar. First, specimens are booked in and given a unique laboratory number specific to each patient and case. We also use photography to document the specimens and show exactly where we've taken tissue from. Specimens are often inked to allow us to identify the different margins. Slicing the tissue allows us to see important details like how close the tumour is to the margin. Once the tissue is sliced, it's placed in cassettes, ready for processing. The cassettes are processed usually overnight, where they pass through a series of stages to gradually remove the water in the tissue, replace it with alcohol, and finally with wax. Once processed, the tissue is carefully embedded at the correct angle into a wax block by specialist biomedical scientists. This stabilises the tissue, ready to cut. The embedded tissue is finely cut to just 4 microns and placed onto a glass slide via a water bath, which helps keep the tissue smooth and flat. The slides are cover slipped, quality checked and labelled, ready for the pathologist to assess.
So how does the pathologist diagnose something? Well, following the patient sample being taken and processed in the laboratory, the tissue is processed and placed on a glass slide. This is then viewed on the microscope by the pathologist, who then will give a final diagnosis. In some cases, it is not so simple to make a diagnosis, and additional tests such as immunohistochemistry and special stains or molecular studies will be needed to make a final diagnosis.
For example, the pathologist first looks at the tissue at low power under the microscope to gain an overview of the overall architecture of the tissue. Subsequently, the pathologist looks at higher power to identify the nature of the cells. The pathologists look at the pattern of the cells because this can often tell them whether the lesion is neoplastic or inflammatory in origin. And if this is something you're particularly good at, this may be a career well suited to you.
An MDT simply means multidisciplinary meeting. And what that means is that you have a whole group of professionals coming together to talk about each individual patient. Post-COVID, most of our MDTs are either in person or online. And indeed, sometimes it's hybrid. MDTs can be fun because we interact with so many people.
The pathologist has a very important role to play at the MDT. Firstly, they provide a tissue diagnosis which will underpin the patient's management plan and convey information about the tumour and its behaviour. Secondly, if the tumour is removed, the pathologist will provide a report detailing the completeness of the excision and any prognostic information, such as the type of tumour, whether it's invading bone, and if it's showing perineural invasion. All this information is extremely important to patient care.
Research is a very important part of most of the oral pathologist job. Even if they're working in an NHS post, there are lots of opportunities to get involved in research, things like clinical trials. But then there are other people like myself who actually are in academic posts, where you might be working with a dental or medical school, and your job actually involves doing research and teaching students. There are quite a few interesting areas of research, and this includes things like looking at how HPV-related cancers might respond differently to treatments compared to more conventional cancers, understanding the molecular landscape of salivary gland or odontogenic tumors, immunotherapy and looking at immune checkpoint inhibitors for cancer patients, and more recently, digital pathology and how techniques such as artificial intelligence can help us become more accurate and try and predict some digital biomarkers of disease.
For me, one of the best things about being a pathologist is being able to provide a diagnosis to a patient. It sounds incredibly simple, but knowing that that diagnosis will ultimately affect that patient's care is incredibly rewarding for me. Secondly, pathology is advancing quite rapidly at the minute, and that keeps the job fresh and exciting as new tumours and tests are described. And thirdly, I don't think there's a better specialty out there for creating a good work-life balance, because we're not tied to traditional patient clinics, which means there's a degree of flexibility in how we go about our daily jobs. So I think there are lots of good reasons to be a pathologist.
As a trainee, I learned by reporting cases and dissecting specimens with my supervising consultants who provide regular feedback. In addition, self-directed learning such as reading journal articles, textbooks, and using online resources are equally important. Apart from diagnostic work, I was involved in audit projects, publication, teaching, presentation, and leadership roles.
So what advice would I give to someone who's interested in the specialty? At the undergraduate level, you could speak to your lecturers. They will be able to give you insight into a career in this field. At the postgraduate level, there are a number of dental core trainee jobs within oral and maxillofacial pathology departments within the country, and you could also seek shadowing opportunities. Finally, our Specialist Society hosts a conference annually every year where you can get the opportunity to network with other consultants and trainees and learn about interesting topics in head and neck pathology.